This is a comment on advancing public health for sustainable development in the WHO European region. The International Association for Hospice and Palliative Care, IAHPC, is a global membership organization dedicated to advancing hospice and palliative care worldwide. We thank the Secretariat for the background document and draw member states' attention to the WHO Public Health Palliative Care Strategy and stress the importance of public health palliative care for the achievement of the Sustainable Development Goals. One of the greatest public health inequities in the world is the abyss in access to internationally controlled essential medicines for the relief of pain and palliative care. Documented in the ATOME, Access to Controlled Essential Medicines in Europe report, the Lancet Commission report on palliative care, Alleviating the Access Abyss in Palliative Care and Pain Relief, the imperative of universal health coverage. In 2014, WHO member states approved the WHA Resolution 6719, Strengthening of Palliative Care as a Component of Comprehensive Care Throughout the Life Course, which recognized, quote, inadequate integration of palliative care into health and social care systems is a major contributing factor to the lack of equitable access to such care, unquote. The background documents rightful attention on early detection and prevention must be balanced with attention to palliative care for all inhabitants of the Euro region, including particularly vulnerable populations such as migrants, refugees, prisoners, and homeless persons who suffer from communicable, non-communicable, and chronic diseases. The global public health community, whose focus, quite rightly, has been on maternal child health and epidemics, must add public health palliative care to the policy agenda. Managing chronic pain and chronic illness with community-based public health palliative care reduces health system costs and improves quality of life for patients, families, and communities. The evidence demonstrates that this is a fair and equitable solution for all populations. IHPC takes a rights-based approach to palliative care and draws colleagues' attention to the international normative framework obliging member states to integrate palliative care into public health strategies. Palliative care is a recognized component of the right to health, which is protected in Article 12 of the International Covenant on Economic, Social, and Cultural Rights, Article 24 of the Convention of the Rights of the Child, and the Convention Against Torture. Access to essential medicines, as defined by the WHO Action Program on Essential Drugs, is part of the minimum core content of the right to the highest attainable standard of health, and 20 palliative care medicines are on this list, including morphine. Access to adequate pain relief is protected under Article 7 of the International Covenant on Civil and Political Rights, which prohibits torture, inhuman, or degrading treatment and punishment. Despite this, many European people continue to die with unnecessary and uncontrolled pain. IHPC respectfully requests that palliative care be included in the Public Health Action Plan for Europe and is standing by to assist member states upon request. I thank you.